Give me the news. I've got a bad case of loving you. No pills gonna cure my head. I got a bad case of loving you.
Good morning. It is Coronavirus Video Journal Day 85. It is the morning of September 19th, 2020. Good news, only one coronavirus case admitted overnight, and patient is pretty much asymptomatic, or so he claims, although when I walked in the room he was coughing, but then when I asked him if he's been coughing or had any trouble breathing, he claimed he felt fine and had none of those symptoms. So, but other than that, so far so good out here. Our numbers are so small at our hospital right now that we've actually shut down one of our coronavirus units and made it into a regular hospital unit again. So we'll see how things start turning out, probably starting next month when flu season starts picking up, but time will tell. Otherwise, keep on keeping on. Wear your masks, socially isolate, socially distance. We'll talk again in the morning. Good morning. It is Coronavirus Video Journal Day 86. It is the morning of September 20th, 2020. Nothing to talk about today. I had no coronavirus patients overnight. In actuality, I only had 2 admissions all night, so it was very chill. Got to watch some movies that I've been wanting to catch up on, and just sitting around the hospital, twiddling my thumbs. So we'll keep it short and simple, as always, apparently. Nothing else to talk about. So we'll talk again tomorrow. Keep wearing your face masks, socially isolate, socially distance. We'll talk again in the morning. Good morning. It is Coronavirus Video Journal Day I don't even know anymore. It is the morning of September 21st, 2020, and light night once again. No coronavirus patients for either myself or my partner. Nothing to report. We did just cross the threshold of 200,000 deaths. That's about it. That's a big number. So, and it's only going to get worse starting next month. So be prepared, start shopping now. Otherwise, I think we're good. Keep wearing your mask, social distance, social isolate, and if you believe in a God, you better start praying to him. And we'll talk again tomorrow. Good morning. This is Coronavirus Video Journal Day 88. It is September 22nd, 2020, and I have nothing to report. Busy night, no coronavirus cases between myself and my partner. That's pretty much it. I'll keep it very short and sweet today because I got to get out of here. But the virus is airborne. Don't believe anything from the CDC at this point, because it is being politically driven, but it has been known for months on end that this virus is airborne and not just in droplets. So ventilation, sunlight, be outdoors, not indoors. And that's about it. Socially isolate, socially distance, and keep wearing your masks, and we'll talk again tomorrow. Good morning. It is Coronavirus Video Journal Day 89. It is the morning of September 23rd, 2020, and I have nothing to report once again. This is getting annoying, I'm sorry. Good for us, bad for me. Very light night. I feel like it's a calm before the storm, seeing as how every night so far has been relatively calm. No coronavirus patients for the entire group. I don't know what to tell you. It's getting kind of creepy that we're not catching any of these cases anymore. Not sure exactly why, but nonetheless, that's it for me. Wear your masks, stay away from other people. We'll talk again tomorrow. Good morning. It is coronavirus video journal day. I don't even know. It is the morning of September 24th, 2020. Nothing to report today. No coronavirus cases overnight. A few sick patients that we thought might have coronavirus, but all of them just had pneumonia that can be treated with antibiotics. So that's it. I got nothing. So wear your masks, social distance, social isolate, and I guess it is worthy to note that the President of the United States has announced as of yesterday that he will override any FDA recommendations in regards to a vaccine to make sure that the vaccine, any vaccine, can be approved before the election. Despite scientists, doctors, and other researchers like epidemiologists stating that that's absolutely ridiculous and someone without a medical or science degree of any kind can make these decisions. So good luck with this vaccine. It'll kill more people than it helps, I promise. But that's it for me. Talk again tomorrow. Morning. It is coronavirus video journal day 91. It is the morning of September 25th, 2020. And good news, kind of, depending on how you want to look at it. I finally got a coronavirus case. A COVID-19 patient was transferred to us from our sister facility for management. Very cool case, actually. Patient is having issues with breathing, obviously, which is why we're admitting the patient. But the patient tested positive for COVID-19 in July. Patient didn't have any major symptoms at that time, so they didn't come to the hospital. All was fine and good, but then this patient has a 10-year-old child who recently started having respiratory symptoms, coughing, sniffling, things along those lines, and shortly thereafter, the patient then became sick. And then over the last few days has gotten so sick that now the patient needs to be hospitalized. Cool thing is, or the question really is this a continuation of the patient's original infection in July? Or did the patient get infected, then lose immunity already, only to be reinfected by the patient's daughter? So, it's cases like this that make you question the ability of a vaccine to work. If a patient has been infected and can be reinfected in general, nonetheless, in less than 3 months, then there's a very high possibility that the vaccines being developed aren't going to be the most successful of vaccines. And just as a precautionary warning, vaccines do have the ability to create a stronger and longer immune response than naturally being infected by something sometimes, although this is not always the case. So, it's just one of those things that makes you think a little bit and makes you worry that putting all our eggs in the vaccine basket is the dumbest thing you could possibly do. So, with that, the smartest thing you can do, keep wearing your face masks, socially isolate and socially distance. As the director of the CDC came out and told Congress, late last week, face masks are going to be more effective than any than any vaccine could be. So remember. Now, that's it. If you didn't notice, I'm wearing new scrubs. These are very expensive scrubs called Figs, and they were a gift from my brother to me, so this is actually the first time I'm wearing them, even though I've owned them now for over 2 months. So, but thank you, little brother, who's also a doctor. But yeah, that's it for me today, and we have one more shift tomorrow, or tonight, and then I'll be done for a week. So we'll catch you in the morning. Good morning. It is Coronavirus Video Journal Day 92. It is the morning of September 26, 2020. I'm finally done for this work week after 8 nights of working, and no coronavirus patients overnight. Go figure. Had my awesome one last night. Now nothing. So that's it. That's the end of my work week. I think, if I can recall properly, this whole week was a waste of time in terms of this journal because I only had one patient. But that's the way it works. So sad for me, great for the area, and that's it. Have a good next week, and I will catch you in October.